Good afternoon, my lovely nurses. I hope you are fine and your family is good. So, today my topic is respiratory acidosis. What is respiratory acidosis? Actually, the respiratory acidosis is caused by a primary defect in the function of the lungs or changes in normal respiratory patterns. Mean, like for example, the normally our lungs are functioning, but in the respiratory acidosis there is a problem, there is a defects in the function of the lungs, in the lungs, and there is a changes in the respiratory pattern. So respiratory acidosis is all related to the respiratory system. So in this situation, patient always have the respiratory acidosis if the patient lungs is not properly functioning and there is a changes in the respiratory pattern. Number two, we can describe like this: any condition that cause an obstruction of the airway leading to hypoventilation or depress the respiratory system can cause respiratory acidosis. Mean the any condition that make the problem in our airway. So hypoventilation mean they are exhaling the CO2. Mean the CO2 is exhaled. They are putting the CO2 outside. Mean they are not inhaling, they are exhaling. So if in this situation the hypoventilation is happening and leading to hypoventilation, what will happen? There is a depression, respiratory rate will depress, and what will happen? It will cause the respiratory acidosis. So the one very important point for any acid base balance, even this is respiratory acidosis or even this is metabolic acidosis, it is important to closely monitor the client's level of consciousness, use protective measures to ensure safety, and monitor electrolyte levels and follow ABG's test results. So any acid base balance, either respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis, so it is very important. We will closely monitor the patient, especially level of consciousness, the patient, especially the potassium level. This is very important because if there is hypokalemia or hyperkalemia, there is a patient have dysrhythmias problems. So very closely we have to monitor, always put the patient to the cardiac monitor and monitor the electrolytes level and the ABG's test results. So in the respiratory acidosis, when you will check the ABGs, you will see the pH is low. pH is low mean less than 7.35. The normal pH is 7.35 to 7.45. If the pH is less than 35, it will show acidosis. And in the respiratory acidosis, there is a CO2 will be high, more than 45, because the CO2 normally is 35 to 45. If the CO2 is more than 45, it's mean patient have respiratory. So pH low and CO2 is high, this is respiratory acidosis. The neurological, the system wise we will check the sign symptom. If you will see neurological, patient will be lethargy, confused, patient is dizziness, patient will complain of headache, and the coma is the uh, serious condition of the respiratory acidosis. If you will see the cardiovascular, in the cardiovascular, patient have decreased blood pressure, hypotension, dysrhythmias, I told you, related to hyperkalemia. For compensation, so always check the patient electrolytes whenever patient is complaining of these symptoms. So check the potassium level. The dysrhythmias can create a high risk life threatening situations if we will not treat it timely. If you will check the patient's skin, the warm flush skins, because there is a peripheral vasodilation. Due to peripheral vasodilation, patient have warm and flushed skin. Gastrointestinals, no any significant findings. Neuromuscular, you can see patient have the muscles weakness and seizures, because due to this respiratory acidosis and the hyperkalemia, the patient will have muscles weakness and seizures. If you will see respiratory problems, so due to the respiratory system, the respiratory rate and depth will increase in an attempt to exhale acids, because he is exhale CO2, So due to this reason, patient respiratory rate will be increase and depth will increase, mean tachypnea. However, when there is a respiratory problem and the lungs are unable to compensate, hypoventilation with hypoxia occur, because patient is exhaling CO2 is not they are not retaining CO2 exhaling. Due to this reason patient is hypoventilation, and hypoxia will occur, mean oxygen saturation will drop and patient have tachypnea. So this the all respiratory system will involve in the respiratory acidosis. So what intervention we have to do if the patient have respiratory acidosis? So always monitor for signs of respiratory distress. Administer oxygen as prescribed, because I told you patient have hypoxia problem due to respiratory acidosis. So we have to apply oxygen, administer oxygen, as prescribed. Place the client in a semi-Fowler's position. Never keep patient in the supine position. Always keep patient in a semi-Fowler's position so he can breathe comfortably. Number 4, encourage and assist the client to turn, cough and deep breathing. This is very important. Number 5, reduce restlessness by improving ventilation rather than by administering tranquilizers, sedatives or opioids, because these medication further depress respirations. Because always give the for example give the semi-Fowler's position, the coughing and deep breathing exercise. This is very important. Instead of we will give opioids and sedative medicine, because this opioids and sedatives, what it will happen, it will more depress the respiratory rate. So we always try to avoid this all opioids and sedative medicines. It will make more problem for the patient. Prepare to administer respiratory treatment as prescribed, like suction the client's airway if necessary. If there is a excretion, we always have to suction the patient so he can breathe comfortably. Number 7, prepare for endotracheal intubation and mechanical ventilation if the client has severe acidosis and CO2 level rise above 50 millimeter per mercury. The normal is 35 to 45, is more than above 50 millimeter per mercury. We have to arrange the endotracheal tube for the intubation. And signs of acute respiratory distress are present. If see the patient is more distressed and there is a more sign symptom related to acute respiratory distress, we have to put the patient on the ventilator. And always keep in your mind, if the client has a condition that cause an obstruction of the airway or depress the respiratory system, monitor the client for respiratory acidosis. Whenever patient will come in your hospital, if the patient have obstructed airway and there is a respiratory depression, always check the ABGs and the electrolytes for the monitor for the patient for the respiratory acidosis. And the last, very important, the causes of respiratory acidosis, because in the exam questions are coming, they will give you cause and they will ask you in this condition either patient have respiratory acidosis or respiratory alkalosis. They will give you many options, but you have to choose the correct one. And the causes of respiratory acidosis is asthma. Why is asthma? Because it's related to respiratory system. So keep in your mind, the respiratory acidosis, the causes all related to the respiratory systems. So asthma is related to our respiratory systems because the resulting from allergen, irritants or emotions cause the smooth muscles of the bronchioles to constrict, resulting in ineffective gas exchange. Because there is a our these muscles, smooth muscles and bronchioles, they become constrict, mean the airway obstruction is there. So what will happen, the gas exchange will ineffective gas exchange. So due to this reason patient having the hypoventilation, and due to this reason patient have respiratory acidosis. Then atelectasis. What is atelectasis? Is excessive collection of the mucus with the collapse of alveolar sacs. So in our alveolar sacs there is a too much mucus. Due to this reason patient have mucus plugs, infectious drainage and anesthetic medication result in ineffective gas exchange. So of course if patient have a mucus collection, there is a mucus plug, he cannot breathe properly, there is obstruction. So due to this reason patient have ineffective gas exchange. So it also can make the problem for the patient respiratory acidosis. Then the brain trauma. Why brain trauma? Because excessive pressure on the respiratory center or medulla oblongata, what they will do, they will depress our respiration. So due to this, due to brain trauma also, patient have respiratory acidosis. Why? Because there is a too much pressure on the respiratory center, and the medulla oblongata, they will depress our respirations. Then number 4, bronchiectasis, because bronchiectasis is become, the bronchi become dilated as a result of inflammation. There is an inflammation in the bronchi, they become dilated, and destructive changes and weakness in the walls of the bronchi occur. So there is a changes in our bronchi walls, and due to this reason there is a problem in the gas exchange. Then bronchitis is inflammation of the bronchi. They also cause airway obstructions resulting in the inadequate gas exchange. It will also make the problem the respiratory acidosis. Then central nervous system depressant. In the central nervous system, depressants mean we are using sedative, opioids, and this one make the leading to hypoventilation, the excessive sedation medication that we are required for reversal of opioid antagonist medication. So what will happen? Carbon dioxide gas retain and the hydrogen ion concentration will increase. Due to this reason, patient have also respiratory acidosis, because I told you opioids and sedation depress the respiratory rate. Then emphysema and chronic obstructive pulmonary disease, the COPD, loss of elasticity of alveolar sac, restrict airflow in and out, primarily out, leading to an increased CO2 level. So CO2 level also increase in the emphysema and chronic COPD patients, and there is also problem in the gas exchange, so patient have respiratory acidosis. Hypoventilation, CO2 is retained and hydrogen ion concentration increase, leading to the acidotic state. So pH is decreased and CO2 increase. In the hypoventilation, it will also create high respiratory acidosis. Pneumonia, excess production of mucus and lung congestion cause airway obstructions, inadequate gas exchange in pneumonia also, because airway, there is obstruction of the airway, mucus, lung congestion, so it will also make problem for this respiratory acidosis. Pulmonary edema. In the pulmonary edema, what is happening? Extracellular accumulation of fluid and the pulmonary tissue. When the fluid will collect in the pulmonary tissue, it will make the problem pulmonary edema. Causes disturbance in alveolar diffusion and perfusion. So when there is a edema or the extracellular accumulation of the fluid, so what will happen? There is a problem in alveolar diffusion and perfusion, so it will also cause respiratory acidosis. Pulmonary emboli cause obstruction in a pulmonary artery, resulting in airway obstructions and inadequate gas exchange, so it will also cause respiratory acidosis. So for the easy way, what we can remember, all problems that is related to our respiratory system, either asthma, atelectasis, brain trauma, bronchitis, pulmonary edema, pneumonia, emphysema, hypoventilation, these all are related to our respiratory system. So any problem whose depress our respiratory rate, the airway obstructions or the problem in the gas exchange, this all related to respiratory acidosis. I hope you like the lecture. If you like, please share and subscribe my YouTube channel, and don't forget to push the bell button so you can receive my coming lectures notification. Thank you very much. Take care of yourself. Allah Hafiz.